Hello everyone, I hope all are doing well. Here is a video regarding Viva model. Come on, let us all look into it.
Hey Dia.
Hi brother,
Where are you going, Dia?
I am going to school.
Oh good, how is your studies?
It's awesome.
Super.
Before I never saw you in this station.
I usually not come this station in this time. Today I am getting early due to Viva exams.
Oh good, which train you need to go?
I just need to go Shimley train.
That's good, I'm also need to go that same train.
Shall we move? Within a minute the train will arrive in platform number 7.
Hey, come inside. When your train arrived in Shimli?
I think nearly before 15 minutes.
Oh good.
How is your preparation for Viva?
All good.
Okay, and this evening can you drop me?
Oh sure.
Hello Steve sir.
Hello Nishant, this is your Viva slot. And this slot number is your Viva room number.
Okay, thank you sir. Good morning Mr. Nishant. Good morning sir. What is ataxia? Ataxia is a lack of muscle coordination that may affect a person's speech, eye movements, and ability to swallow, walk, and pick up objects, among other voluntary movements. Some people are born with ataxia due to genetic factors. Many conditions and other factors can cause ataxia, including multiple sclerosis, head trauma, excessive alcohol intake, a stroke, cerebral palsy, genetics, and tumors. Ataxia may also from certain immunological disorders and infections. Explain any one type of ataxia. Cerebellar ataxia. This type of ataxia results from a dysfunction of the cerebellum, a region of the brain that plays a role in assimilating sensory perception, coordination, and motor control. Cerebellar ataxia can cause neurological symptoms such as jerking or shaking of the body or limbs when trying to move, decreased muscle tone, lack of coordination between organs, muscles, limbs, or joints, difficulty controlling distance, power, and speed of an arm, hand, leg, or eye movement, difficulty accurately estimating how much time has passed, inability to perform rapid, alternating movements. What is inherited ataxia? Inherited ataxia can develop when a parent passes a genetic defect to their child. In some cases, the severity can worsen from one generation to the next, and the age of onset can get younger. Explain sensory ataxia. This is a type of ataxia that develops due loss of proprioception. Sensory ataxia typically results in an unsteady, stomping gait, with the heel striking hard as it touches the ground with each step, postural instability that becomes worse in poorly lit environment. Good. What is proprioception? Proprioception is a person's sense of the relative position of neighboring parts of their body. It is a sense that indicates whether the body is moving with appropriate effort and gives feedback on the position of body parts relative to each other. What is vestibular ataxia? Some types of ataxia can lead to vertigo. This type of ataxia affects the vestibular system, which plays a role in hearing. It can result from nerve damage in the ear. In acute, sudden, unilateral cases, this can lead to vertigo, nausea, vomiting. In slow-onset chronic bilateral cases, a person may only experience unsteadiness. What is diabetic retinopathy? Diabetic retinopathy, drive, is a common complication of diabetes. It is the leading cause of blindness in adults. It is characterized by progressive damage to the blood vessels of the retina, the light-sensitive tissue at the back of the eye that is necessary for good vision. Diabetic retinopathy progresses through 4 stages: mild non-proliferative retinopathy, microaneurysms; moderate non-proliferative retinopathy, blockage in some retinal vessels; severe non-proliferative retinopathy, more vessels are blocked leading to deprived retina from blood supply leading to growing new blood vessels; and proliferative retinopathy, most advanced stage. Diabetic retinopathy usually affects both eyes. Good. What is cataract? Cataract is one of the most common eye problems among seniors. The development of cataracts can cause vision problems and vision loss. A cataract is a painless cloudy lens in the eye that causes blurry vision. It progresses slowly as we age. Most people who reach their mid-70s will have some cataract-like changes to their cornea. Other than aging, causes of cataracts include diabetes, trauma, some medications, and excessive UV light exposure. Okay, say some functions of optic nerve. The optic nerve transmits all visual information including brightness perception, color perception and contrast, visual acuity. It also conducts the visual impulses that are responsible for two important neurological reflexes, the light reflex and the accommodation reflex. What is light reflex? The light reflex refers to the constriction of both pupils that occurs when light is shown into either eye. Fine. What is accommodation reflex? The accommodation reflex refers to the swelling of the lens of eye that occurs when one looks at a near object. For example, when reading, the lens adjusts to near vision. What happens if optic nerve damage? Optic nerve damage is also called optic nerve atrophy or optic neuropathy. The optic nerve is the nerve that connects and transmits information between the eye and the brain. Optic nerve damage can lead to vision distortion, vision loss, and blindness.
Nice, you may go now.
Thank you, sir.